Thank you everyone for joining. Thank you for joining our second web forum, Implementing Racial Equity in County Health. My name is Daryl Lampkin and I'll be moderating today. We'll be beginning shortly. I just wanted everyone to complete our poll, our demographic poll, so that we can see who's joining with us in the session today. Please be reminded that all of the poll results are anonymous. We're just reporting them in aggregate. We'll be beginning shortly. So welcome everyone. Again, my name is Daryl Lampkin. I will be moderating this forum today. This is our second forum on implementing racial equity in county health, sharing our challenges and opportunities. Next slide, please. Today's forum is being recorded to share with others who are unable to make it. If you're not interested in being recorded, please turn off your video and we'll make sure that the recording is available to all participants in our follow-up. I'm going to close the poll now. And here is a poll of the results of who's joining us today. We're excited that so many people of different diversities have joined us today. And we look forward to learning from you all. Before we begin, I'd like to acknowledge that we are on Ohlone land. The Ohlone include a number of Native groups that lived in this Northwest region that spoke a similar language. It's important to understand the long-standing history that has brought us all to this place, to this land that we now call San Mateo County. As part of seeking to understand our place within that history and also to honor the tribes and the descendants of these tribes. Next slide, please. Next slide, please. First, a couple of Zoom housekeeping. For tech-related questions, please send a message via the Zoom chat box to Kathy Harnett. And also, we want to have everyone rename your Zoom name to include your preferred pronouns. You can do that by finding and locating your image profile name in the Zoom. And there's 3 dots at the top right-hand corner. Click on that and you select the rename and then type in your pronouns. All participants will be muted except during small group breakouts. All polls are anonymous and results are shared immediately. To be unmuted and ask a question during the Q&A, please use the raise hand button, which can be found in the participants button on the bottom toolbar to access this button. You can press the *9 to raise your hand if you're using the phone, or you can use *6 to unmute yourself for the phone only. We also encourage folks to chat in questions into the chat box, which will be shared. We're also asking if you have any other questions or comments to please use the chat box. There will be a specific time later on we will have a specific time to answer questions for those who are using phones. Also, the recording will be made available after our session. We also want to thank those folks who have made this web forum possible, those who have organized the agenda and the content, as well as those who have provided technical support to us. We want to highlight Dr. Cassius Lockett, Justin Watkins, Rosa Torpus, Bailyn Sierra, Kathy Harnack, Juvianne Reyes, and Srisha Srinivasan. Next slide. Let's just briefly go over our goals and objectives for today. Our goal is to deepen our understanding of key gaps, opportunities, and priority areas for advancing racial equity in county health. Our objectives are to share participant reflections and findings from our July 15th forum, #1, and post-event survey. We also want to engage in small group discussion on how racial equity issues impact our work and identify key racial equity priorities for staff and partnering colleagues. We also want to identify next steps toward meaningful action. Just a brief overview of our agenda for today. Again, we're in the midst of the welcoming and overview. We'll also have some opening remarks. We'll be summarizing our learnings, and then we'll have our small breakout groups will be the bulk of our forum today. After the breakout discussions, we will have a 5-minute break. We will reconvene to the larger group discussion and share some of our responses from the small group discussion. Then we'll move on to next steps. We'll have our wellness component and then our closing. So while we're here today, a little bit about our framing, I wanted to share a quote from Dr. Maya Angelou, and it states, "History, despite its wrenching pain, cannot be unlived, and if faced with courage, it need not be lived again." As you all know, we're all in the midst of an inflection point in our country about racial justice issues. And we know that it's critical to just be very steadfast in our commitment to do better after knowing better from so many previous efforts that have often fallen woefully short. Our work together as public health servants provides us with unique opportunities to transform inequities in our health system that cannot be unlived, but need not be lived again. We're grateful to work with you as we travel this journey bravely and boldly and with heart. These forums are not sufficient to build trust, but they do open the door to deepen our understanding. They create space for us participants to express what you need right where you are so that you can play a more effective role in advancing racial equity efforts. We also want to identify priorities that will inform a plan for forward movement on racial equity issues in county health and identify specific individual and collective action steps. And then we'll look at some next steps for continued engagement. Next, we will have a pre-engagement survey in which we're just looking to find out what are people's experience having discussions and engaging on racial equity issues. Launch the poll, please. Here are the questions for our poll. How often do you discuss racial equity issues at work? Do you have ideas on how you would like your work to look different to advance racial equity? How supported do you feel by your supervisor or manager to share your ideas and challenges on racial equity issues? And do you know what county health resources or networks to connect to? In discussing what is your biggest barrier to engaging in advancing racial equity in your role? Okay, so there's our polling results. If you responded in our question number 5, what is the biggest barrier to engage in advanced racial equity in your work? If you responded other, please chat in the chat box what your response might have been. Here are a few of our group agreements. You probably are familiar with some of these. These have been shared through BHRS and others. Groups: listen as if the speaker is wise, listen to understand, Practice I statements when speaking. There's no pressure to speak. We also encourage people to type in responses in the chat box. Be disciplined about not making assumptions. Confidentially, if stories are shared, we want to make sure that if we all know that learnings we can share what the ideas of any learnings that are shared here, but to really respect individuals' confidentiality. And next we'll have Louise Rogers, our Chief of San Mateo County Health, who will be welcoming us and joining this conversation. Thank you.
Thank you, Daryl. Can you all hear me? All right, great. So good morning, everyone, and welcome. First, I want to express my gratitude for the engagement of several hundred people who came to our last session in July, for several hundred more overlappers, some of them who responded to our survey, but some new people, and 224 more who are joining us today. So we are all together really paving our racial equity trail in health with our feet. And even if we're virtual, we're taking needed steps to be able to integrate race and racial equity in our conversations and in our work. These are the steps that we need to take. And I think it's really encouraging to be here to see all of your faces and to be today in this session really focused on conversation. And it speaks measures that we're coming together given all of the competing demands that we all face in our work and personally. I recognize that we're struggling with the crisis of the pandemic. We're struggling with the fires and now the smoke and the personal stresses in our own lives, with our families and in our communities. And yet we are here in this important space. And it speaks measures. It's really powerful, I think, to reflect on all of the ways that we are having to stand together in new ways in the face of these crises. And that many of you have been stepping out of your usual roles to be able to respond. And we've all been standing together in new ways. And it makes me ask how we can leverage that learning to stand together in new ways to respond to the call to action for racial equity. I learned a lot from the results of the survey that Erica will be sharing with you shortly. And for me, it reinforces how critical it is at this time to continue to hold the space for dialogue. And I want you to know how committed I am, as well as other leaders in health, to really hold the space for conversation, for learning. And as we are learning more from our workforce and our colleagues and our partners about the trust barriers that are a part of our culture, that are rooted in our collective legacy of white privilege and the ways that power has been wielded historically by those of us who hold more of it, I know that in addition to holding the space for dialogue, that those of us who sit in leadership, and especially those of us who are white and who sit in this place of historic privilege, must really hold the space for listening. That's a big piece of what we need to be doing and what I personally am striving to do. And I want you to know that personally, I am striving to listen with openness and with humility. I know that as a white woman, I personally have unfairly benefited by and been blinded by holding white privilege knowingly, as well as unknowingly in my life and in my career. And personally, I'm really in an ongoing process of learning about that, of being startled time and again by how I could be sitting in a conversation with a friend or with a colleague or with a staff person and learning later how I could be sitting in that same time, moment, and place with this other person who's processing that same experience with stress, vigilance, worry, and even pain, while I'm experiencing it very differently simply because of where I sit in a different place with acknowledged privilege in a larger culture where that is the dominant dynamic. I really have a strong conviction that if we apply our listening and learning to changing our practice, our work within health, we can be the change that we want to see in health. Some of the survey feedback is aimed at systems that are larger than us, and I think we want to go there and be united collectively in the advocacy work that has to happen to impact larger systems. But let's also take action right here within health. That's why we're enlisting your support and expertise, the support and expertise of our staff and of our partners in the community, of our clients, the people whose lived experience can most influence our learning. We know that our county health efforts have strengths, and much of it lies in your contributions. And we have areas of challenge, and we have a need for growth that you started to share in the survey results. So let's have the conversation about what it would take to start here in health. Let's turn the trail that we're all walking into a massive march with all of that momentum, the momentum that we've observed all around us in our community, in the region, and in the nation. Let's have that momentum here, aimed at making us truly all together better. Thank you so much. I look forward to this morning's conversation.
Thank you, Louise.
Thank you so much, Louise. My name is Erica Rincon. I'm a community health planner with the Health Policy and Planning Program. It's great to be here with all of you. I'm going to be sharing out a summary of the feedback that we heard from the small group breakout sessions on the July 15th Racial Equity Web Forum, and also the survey that was issued following that event. I also just want to mention that there's a much more extensive analysis of our learnings from both of these spaces that Shireen had put in the chat box at the top of the meeting. So it's, if you scroll up in your chat box, hopefully you can see the link. It was also something that was sent out yesterday morning. I know many of you registered after that. So we'll make sure that this document is available to everyone after this meeting. It has a lot more extensive information. I just wanted to share briefly on the methodology for gathering this feedback. We were essentially asking folks for their thoughts and input on the strengths and challenges around advancing racial equity in county health, also how to provide more support to staff to be able to do this kind of work, and some of the priority areas that folks really care about in terms of advancing racial equity. Our approach in analyzing the feedback was to really identify the key themes that kept coming up, kept reoccurring in the responses, both within the questions and across the questions. And really highlighting those. We had a lot of feedback. I want to thank all the folks who contributed, 211 survey respondents. We had 272 participants at the forum. And I also just wanted to say that the survey was anonymous, so that did not allow us to collect demographic information or attribute that to the responses. Also, we were not able to follow up with as much clarity on certain points that were made, but still the feedback was really rich. And I also just want to share that this is not the only mechanism where we are gathering feedback on how we can better advance racial equity in county health. I want to acknowledge all the really important work that's been happening this summer to put on and host these race and COVID community town halls. These have been really important events to gather feedback specifically from our community members, specifically folks of color and our impacted communities in San Mateo County, to learn about really their most immediate needs and priorities during this pandemic crisis. And this really helps to inform our learnings as a whole in terms of how we can better advance racial equity. So I just want to lift up all of that work. Now I'm just going to provide a very brief overview of the themes. I can't go into as much detail. Again, that will be in the document. But just to share out that the first theme that really surfaced was number one, normalize the conversation on racial equity. So people highlighted that the fact that the county health system is so committed to doing this work, that in and of itself is helping to normalize the conversation on racial equity. That we actually do have, resources and trainings and specific programs and offices like the Office of Diversity and Equity and Public Health Policy and Planning that have done so much work to help normalize the conversation. But generally what staff need is just more training, more resources, more information that is available to all staff to really understand how you navigate and engage in these difficult conversations on racial equity, both in your day-to-day work and also between supervisors and managers and their staff. The second major theme was advanced systems and policy changes. People highlighted the fact that an important, really important strength is that we have a very committed and diverse workforce with extensive lived experience. This is a major strength. Also, we have a lot of assets already that can help to implement more actionable policy change. People lifted up very much the LEAP Institute, Office of Diversity and Equity and Public Health Policy and Planning. But what was really shared was that we need a more robust set of tools and practices that we can actually apply to specifically our hiring and contracting processes, that we need to have more systems changes around how we can increase representation of people of color, especially in the higher level decision-making positions, that carry more authority. Also, folks mentioned, how can we better apply a racial equity lens to literally like the allocation of our resources and investing more resources in doing this work. We also need clear goals and metrics in order to track progress on advancing racial equity. And then folks really acknowledged that we have to do a better job of integrating the social determinants of health framework in our work, and really acknowledging that all of these upstream factors around housing and jobs and education and even policing, how that is carrying such a huge influence and profound impact on the health of our communities. And we need to bring this in more. The next theme is improve safety and promote transparency and accountability. Again, people acknowledge that the leadership and commitment from county health that we're seeing on this work helps to improve safety so that people can engage more in these conversations and speak freely, and also that the Office of Diversity and Equity serves as a really important model for how you bring in the voices and input from our communities to really inform the work that we do. But folks also shared that there needs to be a lot more opportunities for people to freely and safely provide feedback on the racial equity work that we're doing, to be able to report serious issues like racism and other challenges, and to do this in a safe manner. And also, we should be incorporating the voices of our communities and our clients into all aspects of our work. The last theme is integrate racial equity in current workloads and work culture. People acknowledge that GARE is a very important vehicle for continuing to advance our racial equity work, but that in order for staff to play a much more centralized role and to be empowered to do this, they really need the time, they need the capacity, and they need explicit encouragement from their supervisors and their managers. And that really speaks to creating a culture of expectations to actively work towards racial equity. Now, we are going to just take a couple of questions here. Go back. All right, I think we have a couple of minutes to take a couple of questions on these findings. I am going to, sorry about this, I'm going to try to pull up the participant list. So if you have a question on these findings, I know this was a short overview, but you can raise your hand on video. And if you're on the phone, you can press *9. You can also chat in your questions, and we will be taking back all of these questions and responding to them. Please feel free to indicate if you have a question by raising your hand. Again, you go to participants and you click raise hand or press *9. I am looking for any raised hands. I don't see any. I just want to ask my other helpers if you could see any raised hands, and feel free to let me know if there is a raised hand or a question. I'm not seeing any.
I don't see any either, Erica.
Okay, so why don't we go ahead and then move in to our next session, but please feel free again to add in questions and we'll respond to them. Thank you.
Thank you, Erica. So now we've arrived at the time to move into our breakout groups. The purpose of our breakout groups is to have for.
Daryl, can I just say one? I just saw a hand go up, so I hate to cut you off, but I also hate not to have the chance to have, I think it was Viral who had his hand up.
Yes, thank you, and sorry for, can you hear me? Okay, thanks for the space here. I was just going to ask whether there were similar findings from the work that was done that Erica referred to in the broader community. Those would be really helpful to have as well, if we do have that.
Maybe I could speak up. I don't see Erica on her video just right now. We didn't ask similar questions in the Race and COVID Town Hall. It was very much an open forum for them to share feedback around what their experiences were, what their priorities were, what some challenges may be. So it's not a one-to-one. I think with the point of hearing from what we wanted to make sure to share, by the way, I'm Shireen Malik-Afzali. I work with Erica on the Health Policy and Planning Program and work with Daryl and others on the Government Alliance for Racial Equity work across the health team. And ultimately, we are just, because it's not a one-to-one, we couldn't share that result in the same way. We weren't asking very specific questions. It was very open. And we heard everything from the needs related to testing to questions mostly related to COVID, but economic challenges and other challenges. But definitely race was a factor in all of it, particularly in the recognition of how the racial inequities that are exacerbated during COVID. They were there before, but right now, in particular with COVID and the public health crisis and then ensuing economic crisis, that has just elevated it both to a free fall for many of our communities of color, really challenged, but also illuminated it for many people who did not recognize it to be such an issue. So to Erica's point, we're really wanting to keep our ears open to where we can hear from community and clients as well.
Thank you for that, and also for the wonderful resource from the compilation of the last session's feedback. Thanks.
Thank you very much. So we'll be moving on to our breakout groups. The breakout groups are designed as a forum to connect with one another in order to discuss racial equity issues and share our feedback and thoughts on how our work could better advance racial equity, including action steps to prioritize going forward. Before we begin, please reference the Cultural Humility Agreement. We will be posting those in the chat box in the breakout groups. All participants will introduce themselves, and keep yourself on mute when you aren't speaking. Your facilitator will guide you through the discussion questions. They'll also be posted in the chat box. Rosa will launch us into our breakout groups. Just please accept or join. Welcome back, everyone, to the larger group. We have folks who are still joining us. I'm sure you all had some great discussion in your larger groups, and we'll have an opportunity a little bit later to share some of those ideas that you all have from your discussions in your smaller groups. But right now, we want to take a break. We want to just take a pause. We acknowledge that, you know, doing this work is often personal. It's hard work. It can also be uncomfortable and sometimes even painful. So we need to pause and take a breath and find ways to care for ourselves. So we'll take a couple of minutes 2 to 3 minutes to just take a breather, stretch. You can journal if you like. Make a few notes of ideas that may have come up in your breakout group. So we just take a deep breath. Okay, thank you very much. Next slide, please. So welcome again back to the larger group. This is our opportunity to just share a few of the salient points from our breakout group discussions. We have a couple of minutes, about 10 minutes or so, that we'd like to have a few folks share with us some of their salient points from the discussion. Please raise your hand to be called on and unmuted. We'll take 2 to 3 responses, a few more responses. If you're using the phone, you can press *9 to raise your hand and be acknowledged. You can also feel free to share some of your points, few of the salient points from your discussion group in the chat box. Do we have any hands? Scrolling through all these names.
I see Cardam has their hand up. Daryl?
Yes. Thank you, Shireen. Yeah, I just wanted to say that the session was really thought-provoking. And one of the things that we left off with was that although the cultural competency plan requirements that are in many of our contracts, as a contractor as I am, it's always been important, but it feels even more important now to be able to really put some teeth behind that. And part of the support that we would need would be to, in order to show outcomes and to show that we're really making an impact in our community, is to maybe get some training on best ways to create engagement opportunities for those underserved and hard to reach folks in the BIPOC community that we certainly want to bring more to the forefront in our services and representation wise, figuring out or getting some support with how do we do that even better? You know, what are some best practices around having not just having a plan, but ways of implementing it and then tracking those outcomes. Also wanting to acknowledge just the wonderful support that we currently have from the county leadership around this whole process around racial equity, and wanting to make sure that all of these efforts that we're engaged in, these conversations, get shared with the greater community so there can be even more participation. The efforts that we've put into as Heart and Soul, we've done a lot of work with Office of Diversity and Equity and through the HEIs and Diversity and Equity Commission, and also Office of Consumer and Family Affairs. We have a peer task force that's creating community conversations. We're having our third one coming up on racial equity, white privilege, and becoming an ally. And so just making sure that what we have in place continues to be robust, because it really is about community and taking a grassroots approach also, because I feel that we do heal in community, and empowering our community can help to lift us from the ground up.
Thank you. So, Jamara.
Yes, good afternoon, or good morning, thank you. And sorry to the folks in my group, I jumped out a little earlier than needed, but it was a great discussion. And one of the points that I just wanted to highlight that they discussed was the need for a common understanding and a mission that outlines the goals and expectations for people when it comes to racial equity, which also then leads to institutional accountability, because if you know what the goals are, the expectations are of people, then there's more possibilities of holding people accountable to that mission and vision. So just wanted to mention that one.
Great, thank you. Other hands? So we also invite people to type their comments into the chat box. Okay, Ms. Nicole.
Hi there. I was one of the facilitators for Group 18, and I want to thank them very much for their outstanding contributions. One of the points that was raised by, I believe, Alejandra in my group, but I'm not sure, but was that we can't do this work around having these discussions around equity and training if we don't provide space for folks like line workers to have these discussions. So we actually have to have supervisors who are willing to be trained in holding these conversations with line workers. We have to, the county has to support subbing in support staff so that other line workers can attend these trainings and having these discussions and important dialogues. So we have to make sure that we provide a supportive space to have it, but we also have to have, we have to be willing to put money and bodies so that the work can still be done while line workers have access to these trainings like other folks do. I hope that makes sense. But we can't get it, but we can't get the work done if we're not providing support for everybody.
Great, thank you so very much. Are there other comments? Ms. Priscilla?
So I want to say thank you to my group as well for their wonderful contributions, and thank you, Daryl and Shireen, and the rest of the team for doing such a phenomenal job with these questions and facilitating. You know, we had a really great discussion, and one of the things that really resonated, I think, for all the members in the group is just looking beyond the financial impact of doing things and looking at the importance of the social connection and building relationships. And so when things are coming down the pipeline directives and we're just focusing on the bottom line, sometimes we'll miss out on a lot of great opportunities, and there's a lot of wealth. There's a huge knowledge base among our own staff members, and so sometimes we don't have to go beyond. It's important to focus on something beyond the budget, but really empowering our line staff, especially the line staff that are folks of color. The other thing that I heard was just the importance of training that's up to date, and that folks are flexible to taking that in. One of our folks on our call in our breakout group was an African-American man, and he was sharing like what his experience is and his lived experience, and how important it is for those of us who work with clients to remember that the events that are happening out in real life directly impact our client. And so sometimes someone may come in and they're upset or angry, and we really need to look beyond our own biases and say, what is going on? What is troubling this person, and how can I be better equipped? So really looking to leadership to support training that's current. I think that was pretty much it.
All right, thank you, Priscilla. Okay, Cynthia.
Hi, I was in group 12 and we had a great discussion. Just in summary, we talked about the need to prioritize equity and also acknowledge that it goes beyond our health system. It includes, for example, housing and access to treatment in general, access to resources. And we brainstormed about ideas of ways to engage with our current resources. And some of the ideas we came up with was having a portal, kind of like the wellness portal, where people could find resources and activities, and it could be a place where they could get feedback, give feedback. Having a diversity council comprised of all the various population-specific individuals and leadership. Reminding leadership that we need resources such as funding, not totally within our control though. Having champions for equity within units, and making available equity value statements and policy goals to everybody. And also finding ways to get the word out through Facebook and Google and other social media.
Great, thank you. We have time for maybe one more comment. If not, we'll just move on. Thank you all so very much for sharing and going through the exercise of continuing to normalize conversations about racial equity within our county. Next, we'll have Shireen, who's going to share next steps and how you can get involved. Shireen.
Thank you. Hi, everyone. Again, I'm Shireen Malik-Ghazali. I manage the Health Policy and Planning Unit. I'm the Senior Manager for Policy Planning and Equity. And I wanted to just kind of take a moment to share with you some of our next steps and how this input will be utilized from what we understand as of today. But as you can see, we're all learning and taking your feedback, and we might have lots more new ideas as of tomorrow, but we wanted to share what we know of as of today, and also recognize that input and information is coming to us in lots of different ways, and not just these forums. So many of you are sharing feedback and ideas in other spaces that are also coming back to how we get to move forward on racial equity. And then also how we collectively, what we learn in the health system, we want to share beyond just the health system. So taking a look at this diagram that you see in front of you, you see in the middle goal of having a racial equity action plan. This was something that the Government Alliance for Racial Equity health team developed a few years back, but really just working directly with our own teams and with our division directors, part of a bit of an exercise, really, more than having a really solid plan to move forward with. But some of the top priorities within that plan did manifest within county health, including Racial Equity 101 curriculum development and trainings for all of our supervisors and managers. Our plan is to update that with a much broader set of inputs, including what we're learning from you today, what we learned from those from the last session that we had, the forum, the surveys. We're also going to be sending out another survey to you following this to learn more. We also wanted to share that the GARE team has a set of committees that continue the work and also provide information based on that work. And I'll share a little bit more on the next slide about that, or next couple of slides. We also recognize that division priorities are critical for how things get prioritized and move forward and resourced. And a lot of conversations around racial equity are coming up within divisions around how clients and people are moving forward with that work. We also have the Health Executive Committee has a equity subcommittee, which Sarija mentioned, I think, in the last session in July. And they're also doing a strategic planning process, of which a lot of the discussions and issues around racial equity are being raised there. We're also hearing a lot of our leadership in particular, but lots of ways that input and grievances from staff and clients are making their way to input into the Racial Equity Action Plan. We also heard Erica mention this, but others have also mentioned the critical importance of community connections and hearing directly from grassroots and those clients and those closest and most impacted. And that includes things like the race and COVID town halls that were mentioned, the health equity initiatives, the community collaboration for children's success, the San Mateo Medical Center's Office of Diversity, Equity, and Inclusion, and what they're hearing from their clients. And all of that will go into a racial equity action plan that will have dates and performance metrics and specificity in there that we will then share back with this larger group for accountability. That will take some time to pull together, but that is the goal overall. And as we learn, we're going to be sharing back that information, the information we learned from you here today and in other ways, to the countywide Government Alliance for Racial Equity plan, which is in the works right now. There is about 12 different division or departments that are involved in a training program with the Government Alliance for Racial Equity. So now health will not be the only members of GARE. We also have a new office that the board has allocated funding towards, the Office of Racial and Social Equity, that will sit with Community Affairs Office. And we plan to share this with the leadership there, the information, so they can understand what could be prioritized within their work. And then there's large efforts underway around COVID recovery that the county manager's office is leading, with lots of different community inputs. And we will be sharing back your input and information with them. Next slide. But more immediately, how you could get involved is a number of ways. One is that the Office of Equity and Diversity, Office of Diversity and Equity, I'm sorry, as well as, Erica, you may have the Zoom chat up on this. I think it's visible to everyone. If you might want to, there you go. Sorry about that. We're always troubleshooting tech issues. We will be providing Racial Equity 101 training for all county staff through the Office of Diversity and Equity and the Health Policy and Planning Program, as well as the larger Government Alliance for Racial Equity team across the health departments, divisions. So we want you to know that's coming. We'd also like to offer Racial Equity 101 trainings for the health boards and commissions and advisory groups. And depending on how much capacity we have remaining, we may be able to offer it beyond to some, a few CBOs. We just, unfortunately, our capacity is still limited to be able to offer it much more beyond that. But we know that that is something that we could be expanding on and we'll learn from as we go forward. If you're a board or commissioner interested, please do email me. We will also be sharing a list of resources, videos, clips, readings. And then we also are asking, if you're interested in doing work, kind of rolling up your sleeve and doing something, and you're part of the county health team, that you join one of the GARE teams or committees. And I'll share that with you and how to get involved in the next slide. There's also the health equity initiatives that are open to community-based organizations and much broader that we would invite you to join as well. And individually, we really think that with more conversations and the intention to normalize and leaderships and very specific requests that we continue to think about how we can move racial equity within our individual work, that each of you consider identifying racial equity actions within your existing work and programs, and have those conversations within your supervisory structures so that we can continue to improve and not wait for a racial equity action plan, but to recognize what we could do within the current space and time that we're in. Next slide. So the GARE structure, the Government Alliance for Racial Equity structure, again, this is a multi-divisional group. So there's members of the health team that are part of these different divisions. There's staff from varying divisions across health that participate on a team for the Government Alliance for Racial Equity, where we meet monthly together once as a whole group. And then there's committees where a lot of the work, individual work happens. There's one on capacity building, one on policy operations, one on data, communication and recruitments, and then an intro cohort that right now will be, is really figuring out whether what their structure will be related to the Racial Equity Action Plan. The chairs of those are listed directly under them, under the names, along with their email addresses. And we have opened this up and asked that if anyone in County Health is interested in joining, to please email directly to those names. We will also send the names and emails out following this session, so you don't have to frantically be writing all of them down right now. Next slide. So following the form, as I mentioned, we'll send out an evaluation survey, and we'll share with you the recording, the PowerPoint, a summary of the small group breakout notes, as well as the email addresses and the GARE, how to join one of the GARE committees, as well as how to join one of the health equity initiatives. We will, if there are chatted questions that we haven't gotten to, we will respond to those. We'll be taking the information back that you're sharing with us and sharing it with those in the other recovery groups, the Office of Equity and Racial and Social Equity, as well as some of the other forums that we may be involved in. And then really excited to offer the Racial Equity 101 trainings for county health staff. And we're in the process of identifying dates for that, and we'll be reaching out directly. And with that, I'm going to turn it over to Maria Lorente Foresti, the Director of Office Diversity and Equity, to kind of take us home with the closing.
Thank you, Shireen. And good morning to everyone with us today. We have a diverse group of people with a mix of race, sexual orientation, religion, social status, and a number of other characteristics within our organization and our partnerships. This makes us more equipped to provide the best service to our community and have a workforce that is creative, a workforce that has a variety of experiences and can inform our direction. We serve many marginalized clients that face various barriers. Having a diverse workforce can help our communities overcome these and serve all consumers on the same level. We also know that fostering a culturally diverse environment is the best way to unearth innovation and creativity within our teams. Having a diverse workforce and engaging all of our staff also leads to more effective problem solving. Additionally, inclusivity allows us to adjust and become more change ready in our current world, which, as we've seen, there's many unexpected and unprecedented situations that we're experiencing. An innovative and diverse workforce exposes our teams to various perspectives, experiences, and opinions. On the back end of this, we're able to share ideas and come up with original solutions in a more creative way to dismantle barriers and challenges. And this was seen in our survey earlier this morning, where 86% of those in this room today had ideas about how their work can look differently in regards to racial equity. While diversity doesn't equal inclusion, embracing diversity as health has helps us to foster an inclusive environment where people can share their opinions and be heard. This can be seen by our policies, our workforce education and training about workplace bias, cultural humility training, microaggression prevention, and creating brave and safe spaces to have these dialogues. Not only does this positively impact our work environment, it creates a sense of belonging and engagement. In the past 6 months, I have witnessed our workforce and our partners stand up to the challenges we are facing, providing first-class care to those we serve and compassionately supporting their colleagues, and doing this in a culturally responsive way. We know we have an amazing workforce. These conversations and learnings allow us to continue to move forward, continually learning and working towards everyone feeling a sense of belonging, inclusion, and equity. So I thank you all for being here. I'd also am honored to really end our day by introducing Cindy Donis for a wellness exercise, because we do understand how this is a heavy topic and can bring up a lot for those in this space. Cindy Donis is a licensed marriage and family therapist specializing in infant and early childhood mental health. She began working for BHRS in 2011 with the Prenatal to 5 team, and since 2018 has supervised the Neurosequential Model of Therapeutics program for BHRS, which is a trauma and developmentally informed training program created by trauma expert Dr. Bruce Perry. She provides NMT training throughout the county in both our adult and youth departments. So welcome, Cindy, and thank you for being with us today.
Thank you, Maria. Thank you, everyone, for having me here. I really enjoyed today and enjoyed participating in the small groups and having discussion as well. I want to acknowledge that I think more than ever this year has proved that we have more on our plates, and our plates are either shrinking and getting smaller or are beginning to overflow. And you know, the exercise that I want to bring to you all today is about really feeling that you can go into a place that feels safe for you all. Specifically because there's many factors right now that are creating sense of unsafety for us. The pandemic, racial injustices, our relationships and spaces with people that are changing as a result of differences with racial injustices, uncomfortable conversations we're having, political difficulties, and, you know, even here in our Bay Area, the fires and the air quality. And that's a lot already to get our brains to start picking up on something's wrong, something's wrong. And I think every week we're feeling that something is wrong and we're not feeling safe. And so I just really want to acknowledge that we are here to support so many, and then we go home and support others. And we really have to find the space to care and support ourselves. So I will guide you all in a visualization exercise. And when we complete the exercise, I will call you all back to just organizing and orienting yourself in your own environment with the sound of 2 bells, just to kind of bring us back. Okay, so if you feel you'd like to shut your camera out, you can do so. I'll stay on camera and I will guide you all through this exercise. So to begin, just go ahead and orient yourself in your own seat. Notice the floor firmly under your feet. Notice the chair that is holding your body. Take in one slow, deep breath. Exhale slowly. And just do a quick scan from your feet up towards your legs, your abdomen, your back, shoulders, and facial muscles. And relax any areas where you may feel a little bit of tension. Relax your palms Open up your fingers and lay them flat on your leg. And if you feel comfortable, go ahead and close your eyes. But if not, you can focus on the floor. And I'd like for you to go to a favorite space of yours. It may be an indoor space or an outdoor, and it could even be an imagined place. And notice what you see when you are there. What elements are in your environment? What colors do you notice? Who is there with you? And what do you hear when you are in this place? As you are in your favorite place, take a deep breath in and notice the scents around you. What do you feel when you are here? What is the temperature around you? Any natural elements you feel, whether the sunlight or a breeze. And if there are any thoughts that come your way that perhaps are negative or intrusive at this point, acknowledge that they're there and release them into the environment that you see before you. Take one last opportunity to let your senses fully embrace this space. Take in one last breath. Exhale slowly. And begin to return to the environment that you're in now. And you're going to hear 2 bells as of now. Bring yourself back to the room that you are sitting in. Notice the sounds in your current environment. If your eyes are closed, open them and try to find something orange in your environment. And open your eyes when you are ready. And return to camera. Orange was probably not the best color considering our environment yesterday, but it was the first color I saw on my screen. So thank you. And I just have to say that I had to go to a favorite place multiple times yesterday when there was no sunlight. And I am very thankful for overcast gray skies today. Thank you all.
Thank you so much, Cindy. I think that that helps us leave feeling a little bit more grounded, a little bit more together. So I really appreciate you sharing your gift with us, and also something that we can use throughout the day, during these challenging times. And as the organizers, on behalf of all the organizers and the facilitators, which you'll see here, and our leadership who has been incredibly supportive of our work and open to the feedback that all of you are sharing and that we've been gathering, a big thank you. And we hope you have a great rest of the day. If you'd like to get a hold of myself or Shireen or anyone else, please feel that our emails will be in the information that is sent out, or you could just, if you have our emails, just feel free to email us. And have a wonderful day, and thank you again for being with us today.